Alright, good morning. I'm going to do a posterior drainage. So the first thing I'm going to do is check the patient's chart, and I'm going to notice if they've had any chest x-rays done, so that way I have an idea of where the drainage is, where the secretions are at. And so then I will knock on the patient's door, introduce myself, check the patient ID band, always wash my hands. Then I would apply the appropriate PPE, and like I can do a face shield just in case if they cough up anything or anything like that. So the first thing, I would always check the patient's vital signs, especially the oxygen, and then I would go ahead and listen to the patient's lungs just to kind of get an idea of what it sounds like and kind of where it's located for purposes for me when I percuss on the patient. So when I'm ready, I'm going to position the patient. So when I'm ready, so I position the patient like this. So here's a position where the pillow is like in between their legs like this. And then I'd have a pillow underneath their head. And then I'm going to have them hold their arms up like this, kind of position kind of up and over. So that way I kind of can get an opening of this side so where I can percuss. So when you're percussing a patient, you always want to make sure you don't have any contradictions when doing this procedure. So such as like you don't want anything like if they've had surgery, you got to be careful with that. Note that in the charts if they've had surgery, if they've had broken ribs, you don't want to do percuss on broken ribs. And then also, especially if you're doing it on the back, you don't want to hit the spine. You don't want to injure the spine when you're doing the percussion. And then you also don't want to do below the ribs so you don't hurt anything else. But you want to stay kind of in the middle. You don't want to hit the scapula or anything like that. That way it doesn't hurt the patient. So when you're ready, if you don't have the machine to do the percussion, then you would see if you have the percussion cups. If you don't have the percussion cups, then you would use your hand to do the percussion technique. So you're going to do a cuffing with your hand. You don't want it flat. You want to percuss. When you're percussing, you want to have a nice C shape. That way, so like when you hit the patient, kind of makes the cupping sound when you do it. So you're going to go ahead and do your cupping. So you're going to position the patient, make sure they feel comfortable, and let them know what you're going to when you're going to start the procedure. So that way you don't just start percussing and it makes them startled when you do it. So okay. Mr. P, I'm going to go ahead and start percussing on your back. I'm going to start basically patting your back, okay? So I start doing the percussion, and so then I try, if they can tolerate it, do 3 to 5 minutes. If they can't tolerate that, then I would just do it until they're as much as I can. So then always when you do percussion, you always want to make sure if they're gonna eat, do it prior to the meal, but if you want to wait till after the meal, you need to do the 1 to 1.5 hours after to do their percussion, so that way you don't make the patient sick, especially if you have them laying on their stomach and you don't want them to have an upset stomach. So when you're finished, everything is looking good, you'll reposition the patient back to normal. So you would always remove the pillow, and then you can have somebody help you to position the patient so that way they're facing back up. And when you're done with the procedure, you always need to have the patient cough. So you want them sitting upright like this. You want to have a basin or anything like that so they can cough into that. And then if the doctor needs a sputum sample, then you would have a lab cup so that way they can cough into that lab cup to give to the doctor or to send down to the lab. And then when you're done, you would reposition the patient to where they're comfortable, and then you'd reassess the patient, check their vital signs, listen to their lung sounds to see if it improved everything. And if you feel like the patient is not comfortable with those treatments, you can tell the doctor, kind of suggest maybe doing a PEP therapy, such as like an acapella, or you can do an easy pap, especially if they have a nebulizer treatment. You can do the clearing the secretions out, especially with an easy pap and connecting the nebulizer to it. So when I'm all finished, if they coughed up something, I need to chart it down, note any coloration, how much, and then wash my hands and go chart on the patient's chart and let the doctor know.